started talking too much. Everybody started using that injection, Ozempic and Mounjaro. But the added advantage for people when we used for the type 2 diabetes, there is a weight reduction. The GLP-1 is a hormone. When it increases, it causes, a weight reduction. Hello, welcome back. Today's video topic is now everybody is talking about the hot topic of the weight reduction, the weekly one injection, GLP-1 agonist injections, Mounjaro, Ozempic. That's the topic today. So now people, started talking too much. Everybody started using that injection, Ozempic and Mounjaro, because the for Ozempic the 10-year patent period is over, so every companies started producing, and the cost has come down very drastically. What are these injections? What are these weekly one injections? These injections are mainly uh, uh, you know uh, for used for the diabetes, especially type 2 diabetes. It's not for type 1, it's for type 2 diabetes. But the added advantage for people when we used for the type 2 diabetes, there is a weight reduction. So the FDA has approved these drugs for even for weight reduction, but it has to be given by a doctor with a prescription, because now the 10-year patent period is over for the Ozempic. So the cost has come down. Now everybody started using or misusing. That's the right word. So we'll see about these drug. What are these drugs? They are GLP-1 receptor agonist or GIP agonist. See, in the previous videos, we talked about bariatric surgery, the weight reduction surgery, gastric bypass, how it reduces the body weight. In that, we talked about GLP-1. It's an incretin, it's a hormone. Its main function is, when the bariatric after the bariatric surgery, the GLP-1 increases. This is when the GLP-1 is a hormone. When it increases, it causes, a weight reduction by insulin resistance is reduced, insulin sensitivity is increased, so diabetes under control, your satiety is improved, your hunger is improved. All these things are giving a positive result after the bariatric surgery. So the scientists come out with these drugs. They are available. It's injection tablets, but mostly injections, weekly one injection. They do the same job what the bariatric surgery does, but there are indications, different indication. Still bariatric surgery has more advantage, but it's reserved for certain people. The GLP-1 is a good medicine, but it should not be misused. Okay, how it acts? GLP-1 and GIP, they both have actions in different organs, not working in one place. The first organ is working is pancreas. So with these injections, the GLP-1 and GIP increases. So the insulin secretions increase, insulin sensitivity is increased, insulin resistance is decreased. So the sugar gets controlled, and also insulin spike is reduced. So weight reduction is also possible. It is in the pancreas. Next is it acts in the brain. So in the brain, your hunger is controlled. So people tend to have less food and calorie. So in a positive way, your hunger is controlled, and your satiety, your happiness with the food, the reward for the food is also improved. So they, with the less food, they feel happy. So this is the second part in the brain. The third part is in the stomach. The stomach, the gastric emptying time is increased, so the food stays longer in the stomach. So you don't feel like eating. You feel your stomach is full. Your hunger has come down. So less calorie, and again weight reduction and good sugar control. The next organ is liver. The liver, insulin resistance is reduced. The fatty liver is reversed little bit. So the metabolism is increased. Again, good sugar control and weight reduction. These are the four sites where these injections work. Okay. Who are the candidates? Actually, this is mainly for diabetes with obesity, or diabetes with uncontrolled diabetes, or insulin resistance, It's mainly for the diabetes people or obese people or diabetic people with cardiac problem or obese people, with very normal but they're morbidly obese. And for those people, it's a recommended and it's a very safe one. Okay, so what are the how to start or how to? So first, the doctor will examine you completely because what are the first? You should know the side effects of these medicines. The side effect is mainly in the gastrointestinal tract. What are they? It can give you nausea, vomiting, acid reflux, like you have a, even ulcer kind of abdomen pain, and even your bloated sensation. Your stomach is always bloated, giving uneasiness and pain. Constipation, it could be so severe, even appendicitis can happen. The studies shows the number of cases been reported because of the constipation. Appendicitis is happening, and some people have a diarrhea, uncontrolled diarrhea. So these are the usual gastro, and not only that, even pancreatitis. Even the previous videos we talked about the pancreatitis, the severeness, how bad it could be. So these things can happen. Not only that, in animal studies, certain studies, but not in human people, uh, thyroid medullary carcinoma happening. So these are the things can happen. So the doctor has to weigh the good and bad, prescribing the drug. So who are the ideal candidates? Again, BMI more than 30 or 27 plus, comorbid conditions, insulin resistance, obesity with the diabetes, obesity with the cardiac disease, all are, can be a candidate. But your doctor has to prescribe, examine you, and come to a conclusion. You should not take it from the gray market, because with the weight reduction, with the cost, the price is coming down, because the cost is also, initially it was very huge. Per a month, usually, the Mounjaro costs around 12,000 to 14,000 to start, even up can go up to 20,000. So in a year, 2 to 2.5 lakhs per year. And Ozempic, after the price reduction, almost in a month, 5 to 8,000 to even 10, 12,000. So again, it could be maximum 1.2 lakhs per year. So the cost is also very important. But initially it was very high. So what with the reduction and patent is over, so many companies are coming. So spurious drugs are on the market, gray market. So be careful, ask your doctor and choose the right medicine. And this is not the next day you won't lose weight. It's for a weekly one injection. So the initial weeks the dose will be very lowest, so that whether you have a anaphylaxis reaction or allergy, or whether it's suitable for you, whether it's working and all, will be tested for the first month. From second month onwards, probably you can start expecting some weight reduction. And some people will be resistant and it may take longer time to lose weight. And what is the maximum weight they can lose? Usually the GLP-1, you can expect from around 12 to 20% of the weight. And GLP-1 and the GIP dual, the action Mounjaro, you can expect up the theoretically they talk about more than 20, but practically what we see is 12% to 16 to 18 percentage of weight, usually after months, minimum 3 to 5 months. And the sugar control also, the HbA1c can drop up to 2.5 percentage. I mean 2% can come down. So these are the expectations. But before starting, definitely ask your doctor. Let him decide whether you are suitable, whether it's safe for you. Let him decide, which medicine is good for you. So don't go, the gray market again and again. These are about the whole thing about the GLP-1 and the GIP agonist drugs for the weight or weekly one injection drugs. And the coming weeks we'll see in depth about these injections, and we'll compare about the bariatric surgery. Thank you.